We'll have a moment of silent meditation and pledge to the flag. Thank you. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to call to order this special meeting work session of September 17th, 11 a.m. May I have a motion to go into executive session?
I move that we go into executive session pursuant 6-9A-4-12 to include the following. We have the City of Morgantown, WVU, Health Department, Board of Education, Evan Hansen, and the County Commissioners.
Second.
It's been properly moved and second to go in executive session. All in favor?
Aye.
And we will be going.
Ed,
We have a short
will
meeting.
you relay that it's just going to be a short
Ben.
discussion?
Ben, we're going to leave,
Yeah, you can stay.
okay? All right. And this will be short. For your patience, may I have a motion to come out of executive session, please?
So moved.
Second.
Properly moved and seconded to come out of executive session. All in favor?
Aye.
Now, we're going to begin. Commissioner Sikora, with the aid of Dr. Smith, will go ahead and give our opening presentation. Anybody that wishes to ask a question or put in information relative to what we're discussing, I would ask that you come forward to the podium because it's really hard for mask to be heard from the back of the room. So, Sean, I'm going to turn the meeting over to you with Dr. Smith at this time.
Okay. Thank you. And thanks for everyone, well, Ben and Dave for waiting till we got out of the executive session. I hope the public that's watching this is an extraordinary meeting where we've got representatives from all across the county that have been meeting for a couple of weeks to really kind of try to take a proactive look at where we are in Mon County. I think we got a little bit tired of being the only county in the state that was red, and I think from our standpoint, we didn't really feel like that status was accurate. So we've been taking a really close, granular look at the positive numbers in Mon County. We have members of the commission was on this group, the Monongalia County Prosecutor's Office, the Board of Education, the City of Morgantown, the Monongalia County Health Department, and West Virginia University. So in late August, Monongalia County started seeing a spike in our numbers. It wasn't hard to deduce that the spike was caused by the return of WU students, but we wanted to further dive into the numbers to see the real impact to the actual community. And when I say community, I'm talking about the raw community without including students. Now I want to be clear: this wasn't an exercise to have a narrative and then find data to meet that narrative. It was an exercise to dive into the data and try to really understand where we're at and really try to talk as a group as to what we can do to try to get out of this situation. We found that when we start looking at the data, we found that there really wasn't a discernible one-to-one correlation between the spike that was happening with the students and our raw community numbers. So that demanded more data. So we met a week later and looked at the data, and it was still showing the same thing. And then we had Labor Day, and we had some incidents in the community that we were wondering, okay, what's that spike going to look like? So we waited another week and took a look at the information again. And most of the information still kept showing us the same thing, that we were having, overall as a county, we were in the red and we were climbing, but our community numbers were still kind of staying where they're at. Now, I don't know how to explain that. It's kind of my personal opinion, that I think in Mon County, we're doing really good at doing the right things, wearing masks, washing hands, sanitizing when you come in and out of public buildings. As a county, we put a policy in place in regards to how to react if you were in contact with a secondary individual or a primary individual, or how to react if you were actually positive. So we try to be proactive and put guidance out with the help of Dr. Smith and the health department in regards to how we're going to react, because nobody's been through this before. Nobody had a playbook. So we're trying to be proactive instead of waiting till things happen and say, okay, what do we do with the damage? We're trying to figure out, okay, when this happens, this is what you do. So we are going down a path where we're really kind of only treating or looking at people that had symptoms and people that became, were possibly active. So as we discuss and as we go through this conversation, you're going to see probably a little bit of a paradigm shift where to be proactive, we need to start looking at the asymptomatic people, that don't have symptoms, and maybe have more screening and testing so we can try to break this chain in our community. But I really think that as a community, we've been doing a good job, and I've been seeing that. I go to Kroger's and I don't see people without masks. I see people sanitizing their carts. We put sanitizer in every time we come in and out of a building. We have sanitizer in our car, and the girls go like this every time we come out of the car. So I think we've been doing a good thing, but we weren't. To Charleston, it didn't appear that way. So we started looking really closely at the numbers of W student, and with W's assistance, we really had a nice close partnership where we're looking at these things and getting information from them and sharing information back and forth, and having regular calls and having regular communication, so that we can try to figure things out. So I know as a public, if you are on Facebook, you probably think that there's a lot of discussion about just willy-nilly taking numbers out. No, that would be unwise, and that would be something that none of us would agree to. But we really wanted to understand where those numbers were and what actions we could take. So in negotiations with Charleston, we found that, particularly in the instance of West Virginia University, that they have a dormitory set aside to isolate patients that are patients that are positive. And when we explained, or through Rob Alsop's help, he explained the measures that W was taking place to make sure that these students were monitored, then Charleston agreed that, well, that was probably a good decision. That probably is fair to say that these individuals in Arnold Hall shouldn't be counted against your numbers. So that's what the state has agreed to. And at the same time, I know every time we listen to these press conferences, we come out of them have to have meetings to kind of make sure that we figure out, okay, so how are we reacting to that? How are we going to, what's our next step, and how are we going to be proactive to stay in front of it? But at the same time, Charleston heard us. They also, credit to Charleston and Dr. Marsh, they came up with another metric, which they can do an either-or metric. Look at our positivity numbers, or look at our positivity rate. And I'll let Dr. Smith and the rest of their group explain that, because I understand it, but even right now, we still don't even know how the positivity rate will be calculated. We make assumptions, and we're all going to find that out as we go along. So I think I've said enough. I think in the end, one of the things I'd like to come out of this meeting with a plan or a communication plan for how we're going to be proactive and start scanning more asymptomatic individuals so that we can reach out into the community and try to break this chain and continue to drive these numbers down. Our goal is to break the chain of the infection. 2 is to get back to some sense of normalcy. And for most of us that have kids, a sense of normalcy is having our kids in school. And then go from there. So I've said enough. Dr. Smith?
You want to do the math?
Well,
Yeah.
you want to do the charts and display
yeah.
so that people are they on the screen?
Yes, they are.
Well,
And
that way they can be displayed.
okay.
Please.
Yeah.
One of the
And
things,
Dr. Smith, if you want to assist him in that, please do.
Thank you.
Okay.
we have a 11-page, it's a little bit overkill, but we have an 11-page document. Everybody can see this is the state's website where you can see where we are and you can see where we're orange. And one of the things that I wanted to point out is if you look here at Mon County, there's yellow, green. Marion County is 4.08, so they're really close to being a green county. We also looked up here above us, our neighbors to the north, Greene County. They are a green county. They're rated differently, but when we rate them versus our numbers, they're a green county. So we're a red county in a sea of green, and that shows that we didn't really have the community spread outward. I mean, look at Kanawha County by contrast. Kanawha County is a red county, but they've got gold, they've got yellow, they don't have any green around them. So that, to me, is an example of where you have spread. But what we were looking at, and give me a second here to pull our stuff up.
While Sean's pulling it up, Dr. Smith, did they pull the WVU numbers out of the metric today?
We're trying to figure that
got us
out.
down to orange, or did we just really drop that far? Or do we know?
That's a great question.
I do not, in full disclosure, I do not know the answer to that. I
Yeah.
got a text from the county secretary earlier that we had reached the orange, but I've gone from one meeting to the next, and I haven't even had a chance to sit and ferret that out. If I may, because these are our numbers there. So, just a couple of things I want to start with, and that, let's start with that we are in the orange. And I think you'll see that we've been drifting lower in our numbers, so I think that that's where we got there on our own. And so I want to thank everybody who has followed the guidance and done the right thing, wearing their masks in public, social distancing, washing of the hands, and doing the things that we know work. And we know that we got into the red, and now we're starting to correct. And I agree with Commissioner Sikora that the end point to this, because people sort of want to insert their own narrative in there, but for us in public health, we want a safe community, we want to stop the spread of this disease, and we want to sort of return to some form of normalcy, although we haven't determined what the new normal is in many regards. But this chart here represents, and I'm sorry I've got my back to some of you there, and I would let you know that back here in July is when we started looking at these numbers in earnest. Now, we've been following the numbers since March when we had our first outbreak. But then the metrics began to change, and it was the development of the Harvard system and such. So we were looking at these numbers all the way back to March, and our statistics go back that far. And we did have an outbreak in July that was attributed to many people returning from vacation and not wearing the mask. And then we, County Commission, City of Morgantown, State, Health Departments, let's wear the mask, let's do the social distancing, let's wash your hands, cough in your sleeve, all of those things. And we saw that spike in July go down. So
There's your old one.
yeah.
Yeah.
And so if you can see this is the July numbers, and we were 2 weeks in the red. And we were 1 week in the orange, and then we went down to yellow. And we stayed in this yellow range all the way across the summer, despite vacations, despite people traveling, despite people having meetings. And it was because people were observing the things that we know that work. And the things that work is wearing a mask and social distance, etc. West Virginia University began doing testing aggressively of their student body in July. In the last 2 weeks of July, they started doing it. And we got some positive cases out of that. But you'll notice that they're not on this chart because many of those kids had become COVID positive in their hometown. And we were reaffirming that they had a previously positive case. And as we know, people's noses can harbor this virus or remnants of that RNA for many, many weeks. And so swabbing these kids that were asymptomatic, we saw that they were positive, but we don't count those as a second case. That would be, not appropriate thing to do to count them as a new case because they're not infected. And so so the school starts, and then about a week to 2 weeks afterwards, we start to see new cases. And these are kids that we had a negative test on in July, and then in August they start getting positive. So we know that they didn't come with it. We're not seeing second time people getting infected. We're seeing new cases, and many of them are infected. And I want to take a moment just to refresh people's memories, because we still know that somewhere between 25, 40, 50% of people are asymptomatic carriers. Now, whether they get a fever sometime in their disease may very well occur. Actually, if you can go back again one more, I don't want to get to this slide.
Okay.
So now what we're seeing, and this starts on August the 1st, and we're seeing this, and then we go through Labor Day, and we wanted to see, because it takes 7 to 10 days for people to become symptomatic. We wanted to have that data and a clarity of what this trend is. We're not just taking a snapshot and making decisions on that. As a health officer, I would love to have 105, 6, 12 cases that of samples that we could look at, and I could tell you what the disease burden is in the county. Unfortunately, it's sporadic and it's periodic. But we started to see this, and so this goes from the last 2 weeks, basically, and we have a number of 881 positive cases, and this is kind of cumulative, okay? And then you can see that there's herky-jerkiness to these numbers, because sometimes on Sunday people don't get tested, big reports on Monday, big reports on Friday. So let's go to the next slide. So it is common in epidemiology to try and smooth these herky-jerky movements out by doing a 7-day running average. And so this is what we've done here. Now we shortened it by a week because we took off the sort of the flat part here, but we had to have 7 days. So August the 1st through August the 7th, then on August the 7th we started the 7-day running average, okay? Drop off one day, add another day, and you can see that by the end of August, 1st of September, things are going up. And that's an accumulation of different events. But more importantly, I want to demonstrate that it's pretty clear that the trend of this slide is in the negative, and that we are approaching a better place, okay? And this is a complicated slide, and I apologize for that, but let's see if we can go through this. So the dark blue at the bottom are going to be the off-campus WVU students. The next one, the yellow, are the on-campus. So between those two, that's the majority of students. Then we have a light blue one that we know, because when we got the positive test, they were listed as a student, but then we can't find them, so that data is considered missing. And in my perfect world, everyone would be home when we called, everybody would answer their phone, and everybody would be honest with their responses. But that doesn't happen in this new millennia. And so the top thing, this kind of pinkish colored thing, is those that are unknown. And we're working with West Virginia University and other areas to try to figure out, where do these people belong? Are they students? Are they community members? Are they transients? How do we get them? Do they even live in Mon County? So they are truly an unknown. But I think the big story here is, let's look at the green. So if you're a West Virginia University faculty, staff, teachers, people employed in a county, then you're considered green. And this is the trend that we saw early on, that these numbers, and if you look across here, there were 6 people, 2, 5, 10, 2, 5, 1, 11, 6, 2, 8, 1, 1, and then yesterday, or day before yesterday, 0. So we're not seeing huge amounts of spread. And if that's all that we had was that green, we would be very low. If you divided that out by 100,000, 105,000, then that number would be very low, and we would be yellow approaching green. And so we thought, and if anybody's heard me speak before, I will tell you, and I'll tell you again, the numbers speak for themselves. We do not come in here with a set of directions that we're going to go to and let's see how we can make the numbers fit that. The numbers speak for themselves. And so we're seeing this very small amount of community spread that is factual. And then we can look at the surrounding counties. It's a little anecdotal, but if we hire more people from Preston County than their own county does, and they're in and out of here, and Marion County, and Harrison County, and Wetzel County, and Greene County, and Fayette County, and Preston County, we've covered the entire area, and we're not seeing that community spread. So while I understand the concern that these students somehow, because of their
Interact.
presence
Yeah.
in the community, and people say, well, they get their hair cut here and they shop at the grocery store or wherever, but I don't see them when I go out to eat. And if I pass somebody at the box store or at the grocery store, I pass them in the aisle and they could be anybody. So I think that the amount of input that they have in causing community spread is very minimal, and I think that this slide bears that out. And even if we find out who these unknowns are, which there are going to be community, West Virginia University, on campus, off campus, or in another county, or we just truly don't know, they're still not going to add to the green. And that may be one category they will, but they're not going to be huge numbers in there. So I think that when we started to see, but when we started to see this way the numbers were going, I think that it becomes clear that you can make, there's some decision points that you can make in examining these numbers. And so we weighed out, can we make differentiations between the various groups. And then I'm going to turn this over to Sean, because these are his slides looking at this number. And he's looked at them in various categories. This one is the blue is going to be a student that is missing. They're on the wind. We can't find them. We don't know where they are. Orange is that unknown. We still haven't figured out what category that they drop into. Gold is our community. Gray is the on-campus, blue is the off-campus, and green is the entire total. So if you would look at the gold, which is this little yellow bar here, that is what we just showed you in that other one, but spread out so you can get a better view of it. Those are pretty low numbers. And if you look at these totals here, remember 3 to below 3 is green, and then is it, help me Eddie, where are we at with, above 5
9.9,
to 9 is orange,
and then to 14.9.
is gold, and then above 25 is red. And so that's where these markers are here.
But look
So
what we
if
have.
you only had the community, we would be pretty low. And then if we want to start adding to that various groups, then we can see how that impacts those
So what we
numbers.
did is we just kept splitting them out. We were just looking at it from all different angles. We have, this one has W on campus only, because, the argument is off campus is in our community. But on campus, W had a little bit of control. So we were just looking at these numbers to see what they would show. And so if you look at this one, the blue is W on campus only, but the orange is the community with W off campus and the unknowns. So that's where the community is if we were including W off campus and the unknowns, which the unknowns is about the same chunk as the community. So
Right.
it's like doubles.
And let me just underline here that the on-campus, I applaud West Virginia University's efforts in being proactive in making the opportunity for students to go into the Arnold Hall apartments. It's a secure facility. They are monitored. These people are not out in the community. And so if they're positive and they go into this, then for all intents and purposes, they are not in the mix of the community. They are not spreading it around. And again, having more testing, we will find out who the positive people are, and we can remove them, and whether they're at home or whatever, but isolation is going to be the effective tool that we use.
So we have a couple other views. This is W all total, and then the orange is a community with the unknowns. So as you can see, there's still that disparity between actual what's going on in W, and you do see that tapering down. I think the unknowns is the the bugaboo here because it's making the community numbers go up.
Right.
So again, we just kept looking at every different scenario. And this is the one where,
Yes.
okay, so we have W on and off, we have orange community, gray unknowns, and again, you can kind of look across and really see where the raw community is. So,
Could we state that for the people who are watching it? To me, this is probably this is the page that stood out to me when I first looked at it. Because as you look at it, go across from the community, straight across during the highest peaks, we still stayed the same. That's the same, and people need to understand, there's 15,000 people that come in from outside our area and counties to work, and their numbers stayed the same. If there was a community spread, you would see some sort of spikes, and that's what this data does not show. And that's why this page is really important to understand, because it's raw data. Okay,
I
thank
want
you.
to try to be appropriate with people's time, so we'll
Okay,
talk a little
apologies.
bit more and then we'll give everybody else, but Rob, you may want to talk about this page and your isolation data. But this is the one that we're talking about in
Yes.
regards to the community. So you look at, blue is Mon County as a whole. Orange is Preston County, which, again, they've told us, our friends from to the north have told us that we employ more of their citizens than they do. Gray is Marion County, yellow is Taylor, blue is Wetzel, and you don't see a blue because they're 0.0. Green is Harrison, and then dark blue is our neighbors to the north, Greene County. So you can see as what was happening in Mon County, it really wasn't having an effect on everybody around us. So again, that's just another way of looking at it and saying, okay, so what do we got going on here in Mon County? So, and the last thing is this map. This was yesterday's map, and this kind of shows the same thing. If you look here, this is Marion County. At that point, they were 3.57, so they were 0.58 away from being green. This up here is Greene County and is completely green. So we were red in the sea of green. And as I explained earlier, Dr. Smith, you would, from a health official standpoint, wouldn't you say that there's a lot more spread in
Well, I
Kanawha
think
County?
that let's try to make it clear. Charleston has roughly twice the
Yeah.
population more than we have here in Montague County. So if we have X number, they have almost 2X
Yeah.
number in order to get to the red. And if you look at the positives, it's across the spectrum. If you look at the positives in our county, it's the young people. It's 10 to 19 and 20 to 29. And so those make up 80% of the numbers that we're seeing here. But in this area, it is more spread out across all different age groups. So while I don't want to make it sound like I'm throwing Kanawha County under the bus, there's much more evidence of widespread community-based spread here because it's across all age groups than it is here, which we can look at the numbers and attribute it to specific groups of people.
Does anybody have any questions for Dr. Smith?
I see you ran away. That's not.
Evan, if you want to just go
Evan,
to
if you would come to the
Yeah.
podium so Steve could be heard.
Is the mic on? Or?
Yes, yes it is.
Well, I have a question. I think the best slide is page 3, which
Yeah.
is the stacked bar chart. And it's really a question about those unknowns. I would imagine that whenever you're doing testing, there's always going to be unknowns, and over time, you clear up what category they fit into, or whether you said they may even be assigned to a different county.
Correct.
And it looks like the largest number of unknowns have been, understandably, since 9/11, just in the last week. So based on clearing up the unknowns in previous weeks, do they typically fall in certain of the other categories, or there's just no way to know until
No,
you
it's a
clear
great
them up?
question, but I would say that the answer to that is that we're seeing this phenomena of being unavailable or unable to answer questions, whether it's at the registration or any type of follow-up, is somewhat of a new phenomenon. And I don't want to throw students to be the primary target, but we do know that many people are driving 2 counties away to get rapid testing in Bridgeport Unfortunately, those results go to wherever the insurance home address is. So if this is mom and dad's and it's from Akron, Ohio, or Dover, Delaware, it's off the radar from the local health department, it's off the radar from WVU, it's off the radar from the DHHR. It goes to that other state and may or may not come back. And so what we're seeing is a phenomena of people not being forthright in their demographics. And whether that's attributed to, I'm going to get in trouble, or COVID fatigue, or what have you, the populations that we're dealing with. And I think this goes to the larger point that because there is a fatigue and there is a sense of hopelessness and helplessness, why bother type of thing. And we need to try to change that view of the public so that they're working with county health departments, because this applies to all of us.
But you're still actively working to try to
absolutely.
recategorize those, right?
Absolutely.
Okay.
And we have an extra telephone if you want to come down.
Rob, would you care to address on behalf of WVU? And I will ask Dr. Campbell after that, please, and then Ron after that.
Sure. Thank you, and thank you for the opportunity to be here. I want to say first, thanks for the partnership, Dr. Smith, in helping really since this started back in February, March, of working with the university in addressing this. I'll be brief, just make a couple, three comments. We knew that when we brought our students back, that just by the very nature of this pandemic, that we would see additional positive cases. There are no elegant solutions in the middle of a pandemic. Any which way you go, there are shades of gray and folks who are not going to be happy. We fundamentally believed and still believe that trying with an on-campus experience is the appropriate way to go. We have seen a number of positive cases on our campus, and one of the things I would like to say, both to our university community and to the Monongalia County community, is we've worked through our incident command center and the local health department that as soon as we have an indication of a positive, those students are quickly isolated, and we have a number of mechanisms in place to quickly put folks in quarantine. And you saw that quickly over the first couple weeks of school, to where we went to, and it's on our website, over 400 in isolation and over 1,000 in quarantine. That was not only designed to reduce spread within the university, but to keep that spread within the university and from the community. Second point I would say is that while there have been gatherings outside the class, if you look at inside the classroom where folks are wearing masks and using our plexiglass and those things, we've seen very little spread, knock on wood, with our faculty and our employees. And so we think that a number of the protocols that we have put in place for in the classroom with 50% density and wearing a mask has been effective in preventing spread. The not wearing a mask and being overcrowded in indoor spaces does spread things, and we've seen evidence of that. But the protocols, from our perspective, in the classroom are working and is really relatively low risk right now, and that's a positive thing, and hopefully we'll be able to get back in the classroom soon. And I think there's correlations in a number of factors of if you have lower density and wearing your mask in a classroom setting, it can be a lower risk. The second point that I would say is that we do think that there is a low risk of community spread given the protections we have in Arnold. And so I think, and I am comfortable, given those protections, that we have security measures in place, and we're quickly identifying those positives to move them into Arnold, that we feel good that there's a low risk of community spread. The final thing that I will say is we've been huge advocates of a lot of testing. Mm-hmm. And what we believe that the governor did and his team did yesterday in providing another mechanism to determine what color you are from a county perspective is very appropriate, because we think the more you test, while you may see additional asymptomatic cases initially, in time, what you're going to do by testing broadly in the community is you're going to find those infected folks in a very contagious pandemic. You're going to isolate them and quarantine them, and you're going to gain control over and limit any community spread. And so that's one of the reasons why we jumped at the chance, and I had a conversation with Lee of, we'll make our rec center available, anything we can do to help the community to do more testing. It will help make sure that we reduce any community spread. And so we are a big advocate for additional testing. We're still doing robust testing at the university, over 2,000 a week. We hope to ramp that up. And so I think from a community safety perspective, focusing on testing moving forward, I think is very appropriate. Just one final thing I'll say for us, because I know it's something we've heard in the community of, well, if I get tested, do I have to quarantine for 14 days? Or do I have to quarantine until I get my results back? The way we've done that is, if you're symptomatic, then yes, you need to work with your primary care physician and you need to isolate because you may be a probable case if you're symptomatic. For our screening cases where we're just testing them just to test, we are telling them, wear your mask, double down on being a good partner in social distancing, but it is different than testing someone who we believe is having COVID. A screening test for someone who's asymptomatic, we are allowing to continue to work. We are allowing to do those things. And so working with the local health department, we've had a great partnership in realizing that surveillance and screening testing is a different thing than looking at someone who's symptomatic and testing on that basis. And so I just think that's, as we work towards doing more testing as a community, I think we can work together to make sure that everybody feels good about our safety. So thank you for the opportunity. I'm happy to answer any questions that you may have.
Well, it's Ben or Dave, do you either have a direct question?
At this time, or you
At
can wait
this
till
time?
later.
I'm good.
Okay. All right. Dr. Campbell, if you would, please.
Good morning. I think it's still morning. I didn't look at the clock before I got up here. But first of all, I just wanted to thank the commission for really energizing this discussion. Obviously, as a school system, our primary mission is to educate the children of Monongalia County and bring them into a safe environment to be able to do that. And as a county school system, we've worked very hard to put us in a position to be able to do that in a face-to-face setting. And so, although this map still has us red, I was very encouraged when I pulled the map up today that we had dropped down into the orange. And I think that's a true recommendation. It's a true recognition that our community is doing what Commissioner Sikora had laid out earlier, and that's we're doing our part here in Monongalia County. We're wearing our masks. We are social distancing. We are washing our hands. And I think that if you look at that data that folks have presented to you today, you're going to see that. I also wanted to just take a second just to recognize Rob Alsop and WVU for the efforts that they've put in. There's no doubt that a face-to-face education is the way to go, whether it be at the university level or whether it be in pre-K through 12 education, and we want to get there. And so again, we're very encouraged by the things that we've seen. We're very encouraged by the conversation that's taking place, and we're very encouraged that Charleston has allowed this conversation to exist, and that they're lending an ear to us, and they're trying to find ways to provide relief to the community where relief should be provided. So again, we thank the commission. I did want to recognize two of my board members that are here to take part in the conversation as well. Dr. Sarah Anderson joined us today, and Mr. Ron Lytle joined us as well, the Vice President of the Board of Education. So again, we appreciate that, and I'd certainly answer any questions on behalf of the school system.
Eddie, I do appreciate your comments, and I'm a parent that thinks that face-to-face is best. And I don't know whether it was a state superintendent or somebody else that I heard on the radio the other day that basically made the comment that virtual school is a triage. Mm-hmm. And we've been through you've been through this for a week, 2 weeks, and I think I'm seeing in my own personal experience that yes, it is a triage, and as quickly as we can get those kids to real care, using the triage example, I think the better off we are. Again, that's my personal opinion, but people could disagree, and good-thinking people, may disagree. If I send my kids to school or want my kids to be virtual, that doesn't mean I love them any more or any less. But what we do need is the community kind of understand what we're doing and try to bring together the community, because I do see a real rift in the community.
And just to piggyback on what you just said, Sean, I think there is some disagreement, and we understand that as a school system. When we polled our parents, about 70% of our parents said they wanted their kids back in school face-to-face. And for a lot of reasons. One, they see the value in it. They have to work, so the community needs school from that standpoint as well. But we all also understood and still understand that there is a segment of our community. It's a smaller segment according to our poll numbers, but it's a smaller segment that still aren't comfortable with that environment, and we respect that. We've done a much better job. Triage is a wonderful way to talk about what happened on March 13th. But we've done a much better job over the course of the summer preparing our educators to be able to deliver a better quality distance learning model. And the anecdotal data that I'm getting back is that in most instances, parents are much more satisfied with what we've been able to do these last couple of weeks than previously. But there's no doubt that a majority of our folks want their kids back in school, back in activities as we move forward.
Dr. Campbell, maybe you can add on to this. As being a guidance counselor, one of my concerns that I keep hearing from people is we're only doing this because of sports. And I like to go with, being a counselor, the mental and physical wellness of the kids. I can see it. I know you can see it, and I appreciate how you're addressing that. No, there's an important part with extracurricular plays and also being with those other kids. And if you just want to go over that again, because certain group wants to believe that all we're doing is for sports, and that is secondary.
There has been a tremendous amount of discussion since March 13th, not only just here in Monongalia County or West Virginia, but nationally about the effect that the pandemic has had on young people. The fact that they've been isolated and the lack of socialization is really going to cause school systems to focus on those children as they return to school. And we think it's going to be much more effective if we have them in front of us to be able to do that, as opposed to try and do that remotely. Now, we are doing that remotely. Right. We are trying to address it, but we believe it's going to be much more effective once we have them in place. I did want to mention, too, before I forget, Mr. Alsop had mentioned that, the idea of the more testing. And I wanted to make a public statement just on behalf of our staff that we're encouraged by that, but we're going to take a little different stance as far as promoting that, from the standpoint that in the past we've told our teachers the same type of thing. If you go get tested, we want you to stay home, quarantine until we get your results back, or 14 days. And with the way that the state has changed that metric, I'll be sending out information tonight to all of our professional and service staff to encourage them and to let them know that we're not going to take that stance. If they are asymptomatic and they would like to go and get that test done, they will not have to quarantine themselves. Mask up, wash your hands, social distance, do all the things that we've been asking you to do, and they'll still be enabled to come and work.
That's exceptional.
Thank you.
Thank you.
And I also want to at least thank you for, I know that the special needs children went back on Monday, and thank you on behalf of those people that had contacted me regarding these children, because we know they needed to be in front of instruction.
Absolutely.
Thank you.
Thank you all again.
Delaney, and then I'll ask Perry Jo if she has anything.
Perry said no.
Barry said no.
Okay.
Well, thank you, commissioners. Thank you, Dr. Smith. I have several roles in the community. One is I'm a professor at WVU, and anecdotally, I have had students, or I should say I know that I've had students because they have confided in me that they have tested positive in my classroom, and anecdotally, that has been contained. I've not seen any spread within my individual classes. I'm also a parent. I have a high school child, a middle school child, and an elementary school child. So, we're in the school system at all levels. The reason I'm here today, though, is because of my role on city council and as a mayor. And my general concern in this role is the health, safety, and welfare of our community. And so I think for us, that's always the priority. And I think, our position has been to wait and see what the data reveals. And certainly, I trust and defer to our health official. And certainly, I think what the data shows us today is very compelling. And I think that it's very reasonable, the decision that the governor made to withdraw the Arnold Hall cases from our local data, I think can be well reasoned. And so I certainly don't have any problems with that. I do think that with this additional metric, as others have said, that is going to put in greater impetus on testing. And I certainly think that that will be beneficial to our community as a whole. I do think that these numbers are very helpful, though, because again, when we're concerned about the health, safety, and welfare of the public, first of all, we're interested in reducing the spread and the community spread, but then we are also interested in making sure that folks who maybe, there are families I know that are really struggling right now, and children that are at home or children that are in home conditions trying to learn in situations that are not very suitable or very conducive to that. And so I think if these numbers allow us to understand the numbers, in a more honest and authentic way, and it allows us to return to some sense of normalcy, especially in terms of our young people and the education that they're receiving, then I certainly think that's a positive thing. So thank you again for your work on this.
Thank you. Yes.
I said, thank you, Ron.
Oh, yes, sir. Before we wrap up, do any of the press have any questions directly that they wish to? Hearing none.
Question I have, the Arnold Hall students are just the on-campus
Correct.
students, right? Okay.
Anything else? Sean, any last words?
I'm good.
Tom?
Just-
Tom's always going to have the last word.
I always have to, no, all I'm asking for is that we wanted to be transparent. I can't say enough about WVU working with us, the health department, the school system, and especially what Dr. Campbell just said, because there's been a lot of questions, and they are modifying it because they want to do what's best for our community. And I only ask the public to look at the data and the facts and be open-minded.
And I'd like to say one thing. I basically be stay tuned, because this thing is
Yes.
evolving. We have not received what the actual measurement is for the positivity rating and how that's calculated and how we'll move forward, and what those numbers mean, the 5%, the 4%, the 3%. So as those numbers come out and that information's come out, we'll try to share that information so that we have a better understanding, because what we want to do is promote information and be upfront and be transparent. What we don't want is people to have to go and figure it out themselves. And we don't always get a clear indication, so we'll try to get the answers. I mean, I'm on the phone with Dr. Smith, and I probably asked him the same question 100 times through this pandemic, but something else comes up, and then I forget what I asked. I forget I asked him the same question the previous week. But if you have questions, let us know. We'll try to get you the answers, and really just kind of stay tuned, and hopefully we can embark on a new campaign to increase the communication and increase the testing, and we'll go from there.
And lastly, I really want to thank everybody who has been participating over the course of the past weeks, months. When somebody said this is a part-time job, it's not in Montague County. And I really want to thank, however, all the partners that we have. I want to thank my commissioners and Renetta. Dr. Smith has been invaluable, and I also think that it was invaluable that you were consulted regarding our county. That I think is getting the message. And we're not trying to put a message to Charleston. We want frank and open communication. And I do believe that that is the best way. We have people here who are concerned, and we will continue to be concerned. I want to encourage everybody to go out and test. And I think that as a commission, we should lead the way. go and get tested. And with that, I will take a motion to adjourn.
Move to adjourn.
Second.
Properly moved and seconded, we are adjourned. Thank you.
Thank you.
Thank you all for your patience.